전 세계 하루 확진자가 80만 명대를 넘고 있습니다.
Life may never be the same after the coronavirus pandemic.
코로나19 하루 확진자는 오늘 다시 늘었습니다.
집단 감염 사례도 이어지고
결국
있습니다.
접촉을 줄이는 것 말고는 해법이 없습니다.
But there is one thing that can get us close. It's not masks, it's not treatments, it's not social distancing, it's vaccines. Humanity has lived with the worst respiratory pandemic in modern history for almost 1 year now. After months watching the disease spread globally, we're just starting to see a light at the end of the tunnel as some countries begin vaccinations. Britain was the first to kick off inoculations on December 8th. Over the past few weeks, the list has extended to United States, Canada, Europe, Switzerland, Israel, Mexico, and more. But while these stories make good headlines, the big question most people want answered is, when will that vaccine reach me? According to government announcements, vaccination in Korea is slated to start in the first quarter of this year, in late February at the earliest.
접종을 시작할 수 있을 것으로 예상하고 있습니다.
However, that doesn't mean that any Korean will be able to walk into a hospital and get vaccinated. The launch in the first quarter will only be the starting point of a long vaccine program, which in its early days will focus on people at risk, like old age citizens or medical staff. As of January 5th, the Korean government announced it secured vaccines for more than 56 million people. Korea has a population of nearly 52 million, so that's enough to inoculate the entire country. The government has signed supply deals with AstraZeneca, Janssen, Pfizer, Moderna, and the COVAX facility, which is a global COVID-19 vaccine distribution program backed by the World Health Organization. We do not know which brands Korea will receive through the organization. The Korean government's goal is to realize herd immunity by September 2021, which refers to a stage where a large portion of the community becomes immune to a disease. But the arrival of vaccines is only the start in a very long, hard road to herd immunity. There's a long checklist of important and difficult decisions to be made, and the biggest question is, who gets it first? The Korean government has made it clear that the first supply of corona vaccines will be provided to elderly people and medical staff. But it's likely that vaccine imports will continue to come in limited batches throughout the year as countries compete for supplies. This means second tier, third tier, and other groups to follow will also need to have boundaries set to decide who is eligible. Logistics is another major issue. Vaccines are biological products, so they need to be stored and transported in specific conditions to remain effective. AstraZeneca and Janssen, for example, can be stored at temperatures of 2 to 8 degrees Celsius. Moderna and Pfizer, on the other hand, are mRNA vaccines that require storage in extremely cold temperatures. One local study found that Korea is wildly unprepared for national vaccine distribution. In 2018 and 19, only 38.5% of public health centers and 23% of private medical institutions had vaccine-appropriate refrigerators of 2 to 8 degrees Celsius. Barely any had facilities suitable for mRNA vaccines. It's very natural for viruses to mutate and evolve, but leading vaccine developers have expressed confidence that their products will work against the variants found so far. None of the mutations identified were so different that they are likely to negate the efficacy of developing vaccines. That could change, however, depending on how drastically the coronavirus evolves in the future. If a mutation emerges so strong that it can't be controlled by existing vaccines, that would essentially restart the entire development process.